It's no secret drug misuse is a major problem in our community. It invades all walks of life, including the sports world. It's why Wilkes University in Wilkes-Barre invited a well-known former Penn State football player to speak at this year's Pennsylvania Pain and Addiction Summit.
The day after I graduated, I went off to Penn State to begin my college journey.
As a then 18-year-old incoming freshman at Penn State University, Adam Taliaferro's football future seemed bright. But in the fifth game of the 2000 Nittany Lion football season, his life would change forever.
I went in to make that tackle, and I broke my neck and was paralyzed from the neck down.
Doctors said his spinal cord injury meant he most likely would never walk again. But after spinal fusion surgery and months of grueling therapy, Taliaferro defied the odds in less than a year. Now, more than 2 decades later, he gave the keynote speech to medical, legal, and law enforcement professionals at the 5th Annual Pennsylvania Pain and Addiction Summit at Wilkes University.
The doctor said I had a 3% chance of walking again. And with anyone that's going through addiction, I'm hoping that those odds are higher.
Those at this summit are working to help improve the odds, including Amber Mansfield. The Pain and Addiction Summit panelist is the widow of an Army veteran who succumbed to substance use disorder.
His first real battle with opiates was from an injury he incurred.
Army veteran Michael Mansfield died in 2016. He'd been struggling with powerful pain medication for nearly a decade after his Humvee was struck by an IED while he was deployed on a peacekeeping mission in Kosovo.
He definitely had physical pain, but I think the emotional pain was bigger.
Coping with both is very much on the minds of those who attended this day of collaboration.
This is something, whether it's pain management or substance use disorder, that is not something that can be handled by one particular profession. Physicians, pharmacists, nurses, legal professionals, social workers, we all have to come together for this. It's the ultimate team-based sport.
It's important for me in my practice so that I could treat cancer-related pain in patients that may have substance use disorders, and knowing how to treat them safely and effectively.
It's that philosophy that Wilkes University's new Dean of Pharmacy says is being used to teach the next generation of medical professionals.
Here at Wilkes, we try and develop empathetic and compassionate pharmacists as well as nurses to be able to go out and engage with their patients, listen to them. They may not have all the answers, but they should have 2 ears to hear, 2 eyes to see, and 2 shoulders to lean on.
Support and hope. It's what helped Taliaferro overcome paralysis. It's what he says can also help those trying to conquer opioid use disorder.
And so I say if I can do it, I'm no different than any of them. Hopefully they can do the same thing.
Wilkes University's Dr. Franco compared solving the opioid crisis to a journey of 1,000,000 steps. He added, with each Pain and Addiction Summit, we are getting 1 step closer to the end goal. State Senator Doug Mastriano is touting a new law's effectiveness at addressing the opioid crisis. Mastriano sponsored a bill requiring law enforcement to report and document overdose incidents in a statewide tracking system, which went into effect in January. The system will help local officials identify trends and alert first responders to areas with high rates of overdoses.
This new law will improve overdose response, help those with addictions get the treatment they need to get out of this web of this cycle of addiction, and as well as getting these drug traffickers off the streets.
The system also tracks if Narcan was administered. The need for Narcan availability in our community is very important.
So the naloxone really is the first step that may save someone's life.
Next, how Narcan is saving lives and helping give hope for recovery.